Hey y'all, it's Ernice and welcome back to my channel where we talk about everything between healthcare and the law, but of course a little bit of business on the side. I am a retired nurse and I've been a lawyer for 10 years, and I talk a lot about ways in which healthcare providers can improve their practice to also protect their patients. We're going to jump into a medical malpractice case that recently came out of Illinois. And if you like that type of content, make sure you hit the notification bell, and of course, subscribe. If you want to share with your community, or if you're an educator and you want to use this as an opportunity to educate your students, please feel free. So we're going to jump into this story. The article is linked below if you want to follow along. 8 years after CP had a stroke, he essentially was awarded $41 million because he needs around-the-clock care. Cook County jury ruled in favor of Pierce and his wife Susan after a month-long trial. The award is believed to be the largest in Illinois history for medical malpractice case involving a plaintiff over the age of 70. So basically, in 2016, CP was admitted to Francis Hospital. He had pneumonia. While he was hospitalized, he ended up developing acute kidney injury from pneumonia treatment that required short-term dialysis. So we as clinicians know that sometimes people come in with one thing and they end up getting another, and that is already tragic in itself. So he was still working as a lawyer, living his life, doing well, and then ended up with pneumonia that led to dialysis and, of course, his acute kidney injury. A cardiologist also diagnosed CP with a common heart condition that causes abnormal heart rhythm. So he was given an anticoagulant to minimize the risk of stroke, likely AFib. And again, that's due to all the stress that is going on in his body, whether it's from the medications or his own personal stress from being away from his life or whatever the case may be. So he comes in with pneumonia, he has acute kidney injury, and then he also needs short-term dialysis. Now he also, on top of this, has a new medication that he is taking because of his abnormal heart rhythm. The medication required daily blood tests to make sure it was working as intended and not causing problems with blood clotting. Okay? Daily tests are needed. His condition took a turn for the worse after he was discharged from the hospital and arrangements were made for dialysis, but nobody made plans to monitor his blood. So he was given the education, he was given the information, he was given the medication, but he wasn't set up for the services that he needed. Red flag number one, right? A few weeks later, he ended up having a large cerebral artery stroke in his brain, and it showed that he had a large clot lodged in his brain, cutting off circulation to nearly all of the brain's right side. So when you have a right side brain infarction, it impacts your left side. Blood tests were taken while he was at dialysis, and it showed that his levels were dropping dangerously. None of the doctors noticed it or adjusted the dosage that would prevent a stroke. This is why when you're taking certain anticoagulants or certain medications, you have to check your blood daily, because you have to adjust the medication to prevent the blood clot from forming and causing the stroke, right? He was specifically on the medication to prevent this from happening. At 72, he was paralyzed on his left side, and he also had severe cognitive deficiencies. In 2020, this case was filed by a law firm in Illinois that essentially sued Fresenius Medical Care of Illinois, Renal Care Associates, a physician, and OSF healthcare system. The lawsuit claimed that the cardiologists, nurses, and other personnel were negligent in failing to monitor CP and increase his medication dosage. How do nurses get involved in this conversation? It's because we are a part of the care team. And this is why clear communication, asking questions, and inquiring when you are uncomfortable with what's happening is important. So it also claimed that the hospital was negligent and relied on the kidney care providers, which were external from their organization, Fresenius, and this physician to manage Pierce's heart condition. So during the trial, which started in April 10th and ended May 6th, the hospital's personnel and the kidney care providers admitted, right, that someone needed to manage the medication and the levels. But everyone said, it's not my responsibility. It's their responsibility. It's their responsibility. And that doesn't necessarily work in court. The court is not going to say, oh, you think it's their responsibility, so they should essentially take care of it. Or you think it's their responsibility. As a healthcare provider, if you are involved in someone's care, you essentially are partially responsible, if not completely responsible, especially if someone dropped the ball. So the jury's verdict, of course, was very difficult for the hospital and everyone involved. They didn't specifically name all of the personnel, but it named the overall general providers, of course, Fresenius, which is the kidney care center, and then the provider who was there taking care of the patient at the dialysis center who should have been reading their labs. Because he was still practicing law and working, and essentially before this could have recovered from his pneumonia, his acute kidney injury, and then it was short-time dialysis, so the expectation was that eventually he would have been off dialysis, but now he's paralyzed on the left side, he has cognitive deficiencies, and he's unable to work. They have to now pay for the year's loss of the work that he would have been doing, but also the care that is provided because, according to the jury, they failed to monitor. So when we talk about medical malpractice, there are different things that could potentially happen, right? It's either because of failure to monitor, it's negligence, sometimes it's just a bad actor, right? Someone who purposely does something to harm someone else. People are always afraid of being sued, but this clearly shows in this situation that this could have been prevented, that this didn't have to happen, that if someone would have, one, double checked that he had been receiving care at home, whether through a home care agency or his family was taking his blood levels every day, or when he was at dialysis, somebody was reviewing his labs, then this wouldn't have happened. There were just too many points and opportunities for someone to be able to provide care for him. So when we talk about medical malpractice, right, and the common reasons, sometimes it's surgery or medication, a lot of times it's birth injuries, anesthesia, diagnosis, or failure to treat. We also want to talk about the main reason why and how medical malpractice is prevented: communication. Right? There were multiple communication failures done from discharge to, ensuring that he was getting treatment for his kidney failure, but also the fact that someone should have been calling to check up on his labs or to ensure that someone was taking his INR or checking his daily INR levels to ensure that his medication did need to be changed. And so I always wonder, for those of you who have questions, like, what would you have done, right? If this happened to you or your family, would you have just accepted that they made a mistake and this wasn't a big deal? Or would you have said, like, this is a big deal. Like, I have to care for my family member 24 hours a day. They have lost so much in the process. It took 8 years for this case to settle. So that means in between the time that the case was filed and the injury happened in 2016. The case was filed 4 years later, and then it took another 4 years for them to actually receive an outcome. And that is difficult in itself. So that means that for those 8 years, his wife and family were taking care of him themselves. And hopefully he had some type of disability insurance or resources to help with that, or they would have been taking it all on their own. And so I know that it's difficult for healthcare providers and clinicians to say, like, oh, we're responsible for this medical malpractice case, or, we're always getting sued, or why are people attacking us and coming after us? But the outcome is also, like, someone needs to be compensated for the damages that they've experienced. $41 million is a lot of money, and typically that means that the people who are responsible, the kidney center, the hospital, the physicians are going to probably try to appeal, or they're going to also try to decide who is responsible for what, like in a percentage wise, right? How is this going to be settled? That may take another 2 to 3 years. He may not even be alive in that time. And so I want to always caution healthcare providers to not focus on the problem, but focus on the solution. Clear communication, following up even when you think something has been done, but also putting systems in place to ensure that this doesn't happen to anyone else. What are your thoughts about this case? What questions do you have? And after you read this article, let me know your thoughts. Make sure that if you like this type of content, you want me to talk about more cases and things related to healthcare providers, but specifically and especially nurses, like, comment, and subscribe, because that is how I know that you want to hear and see more of this type of content. Thanks so much for watching. I can't wait to talk to you guys again.